Hello, I'm Dr. Aaron McMichael with McMichael Chiropractic Clinic. Today I'm going to discuss exercising the right way. So I'll give you some practical tips and strategies for healthy exercise. Let's go ahead and get started. Working out should be a challenge, but it definitely should not be painful. This is not no pain, no gain. Maybe a little soreness, but not real significant pain. So if you find yourself running straight for the ice packs, maybe aspirin after working out, trying to find something for immediate relief, you may be doing something wrong. That's a signal that you probably need to modify how you're going about your exercise program. So before you convince yourself you have a wonderful excuse to quit, we don't want you to stop. It's time to evaluate your exercise program. Maybe a few modifications will get you back on the right track. So let's look at some more specific advice here. Start with good stretching and warming up. So the stretching before your workout should be light as your muscles are cold. Warm up for about 10 minutes, then stretch slightly to avoid extra muscle tearing. Just like the rest of your workout, you don't want to jump right into too great of a stretch too quick either. You want to ease yourself into it. You want to get those muscles a little more relaxed, a little warmer before trying to do too much with them. Then we can do a little more and a little bit more, and we'll be in better shape, better prepared for the rest of our exercise routine. It is very important you have to exercise at the proper level. So if you're just getting started, you're going easy. A beginner should not try to bench press 300 pounds or run the treadmill at the highest level. You don't start with a marathon the first time you run. Starting off slowly will make you stronger faster, as you will avoid injuring your muscles. We see this all the time, especially around the beginning of the year when everyone gets motivated again to start exercising in the gym. They try to do too much too quick, and they hurt themselves to the point they have to stop. And then if they do start again, they're starting from the beginning. So even though it seems like it's slower, you're actually going to move at a faster pace, making better improvement if you take your time starting off slowly. So you should feel invigorated and even a little sore. Some muscle soreness is okay to let you know you're working those muscles, but you certainly should not be in agonizing pain, and it shouldn't be more than temporary. Proper form is a must. Improper form leads to injuries and inefficient use of the muscle and your time. It is always quality, not quantity, that will get your results. You're definitely better off with a few well-controlled, precise repetitions for an exercise rather than cranking out 1,000 reps with very poor form. Not only will you be injured, it's just less effective for the exercise as well. So at times, different facilities may have trained professionals. They could also give you some advice, some help, look at that form, and give you a few tips to make sure you're doing things the correct way. This is very important. Good form, of course, starts with proper posture. So think about this for a minute. What would happen if you held a bowling ball with your arms straight out in front of you all day long? Now think about carrying your head in front of your shoulders all day. That's just like carrying a 12-pound bowling ball that way. So in the picture on the right here, we have this gal who is allowing her head to come forward. So that bowling ball we have of a head, when we let it come forward like that, it's a lot more work on those muscles, more stress on those joints. That's going to be felt through the neck, shoulders, even through the rest of the back. Now imagine the problem exercising with this kind of posture. So again, let's take our bowling ball. What if we had to run on a treadmill holding a bowling ball straight out in front of us? Now think about if we tucked it in right at our side. It'd still be some work. That's a 12-pound bowling ball, but it's a whole lot easier. It's a whole lot less stress and potential for injury on neck, shoulders, back, because Going forward with that poor posture is going to alter all kinds of things we do positionally down through the rest of the spine and even down through the legs as well. So we want to make sure we have good posture to start off with. Here's a quick way to check. Grab a partner. So looking at the body from the front, look right down the middle. Look between the eyes, chin, and on down. Is everything nice and straight? That's what we want. You shouldn't have shoulders off to one side, hips off to the other, one knee going a different way. Everything should look nice and even. And how about horizontally now? Look across those shoulders. Look across the hips and knees. Are those equal height? If they're not, maybe that's a sign of a scoliotic curve. Or maybe that's a temporary change you don't even know you're doing because your body's trying to find a more comfortable position. That's something you need to make sure gets corrected. Is the head held straight and not tilted or turned to one side? When we evaluate a lot of patients, we see they got a little rotation or maybe a little bit of head tilt. They don't even realize they're doing, again, as their body tries to find its own position that's a little bit more comfortable. That needs to be corrected. We need to be straight and even, or that is going to put more stress on our body and make it more likely we're going to have some injury when we're active or when we go to exercise. And just one more thing related to the posture here. Standing up straight is important for everyone, but at no time is it more crucial to develop the habits of good posture than in childhood. Many adults with chronic back pain can trace the problem to years of bad posture habits or injuries as a kid. Because they are growing and more active, children may be at even greater risk for injury to the back and spine. Again, we see this often as adults come into the clinic. They relate similar issues way back years prior to something that happened as a kid. And as a kid, we don't always know better, so we let these things go on and fester and turn to bigger problems later. We need to make sure they're addressed early. So check your friends, check your family, when you return home or go to work tomorrow, take a peek, see what you notice. All right, so back to our workout now. After that workout, again, this is a good time to stretch some more. So you want to stretch more thoroughly. It's very important to stretch the muscles you have just worked in order to get the most out of the exercise. Stretching the muscles lengthens them and allows them to heal stronger and be more limber. Flexibility is just as important as strength. The more we bend, the less likely we are to break. We don't want to be brittle. We don't want to be fragile. Flexibility helps protect us from that. Resting, appropriate rest, is just as important as the workout itself. So one should not exercise the same muscles in the same manner every day. One, that's just not going to be effective for making good improvement, but it also isn't going to allow the healing that needs to occur. Exercising tears down the muscles. When it's done right, that's in a good, beneficial way, and then it's the healing of the muscles that makes them grow and become stronger. But we need time to allow for that healing. So allow rest after the workouts. Make sure you're switching up which part of the body you work out on different days so the body has a chance to recover and then build next time you exercise it. Use the proper equipment. And that could be as simple as the right pair of shoes. We don't always need fancy, specialized equipment, but especially if we're someone who's already had to deal with injuries, we need to make sure we're using what allows the best form of exercise to support good, healthy exercise without any further injury. Check with your doctor. So if after trying these different tips and strategies, you're still experiencing pain, then make sure you get checked. You may be doing an exercise that's not right for your body or have caused an injury that needs to be addressed. And you don't want to let that linger for too long. Don't let a simple acute injury that's fairly easy to get under control turn into a chronic, ongoing, repeated problem. that becomes much more difficult to heal. A little bit on your nervous system and exercise. Your brain communicates with every part of your body through miles of nerve fibers that make up your nervous system. It's kind of like an electrical system running through the house, connecting things, turning them on and off, up and down. Exercising actually works the brain and nervous system as well as the musculoskeletal system. That's part of the benefits of exercise too. We're actually training that brain. We're going through movement patterns that the nervous system learns that helps with balance and helps us with good form as we go about our normal day's activities as well. When it comes to the spinal column, the brain is protected by the skull and the spinal cord is protected by the bones of the spine. Then there are the surrounding soft tissues that give the spine the ability to bend while maintaining its protective alignment. It's like this specialized armor because it is super important that we keep our nervous system protected. Again, if it controls everything, we don't want to be losing that control. Proper nervous system function must be protected to maintain health, and movement is key to keeping the surrounding joints and soft tissues working well and feeling good. So stay active to stay healthy. Physical activity is very important to stay healthy, but you have to take care of yourself and avoid injury. And perhaps my best advice to patients, the best exercise is the exercise you will do. We can give all kinds of specific tips, specific exercises, but when it comes down to it, if you love cycling, if you love swimming, if you love running, do it. Just do it. Be active. That's going to get you moving. That's going to keep you healthy. So do what you enjoy. Thank you for learning today. A special thank you to the Foundation for Chiropractic Progress for assisting with resources. If you'd like to learn more about being your healthiest and how we can help you at McMichael Chiropractic Clinic, check us out at mcmichaelchiro.com.